All right, so the muscles of the respiratory system. Now, a lot of us may just be familiar with our core muscles. When we're working out or exercising, most of the time we're asked to sort of like brace ourselves in terms of our abdominal pressure. But in addition to our abdomen or our core, there's also the diaphragm, which we're going to be really focusing on today, and also the pelvic floor. What you see here in the image is that it's sort of like a balloon. So on the top is the diaphragm, on the bottom is the pelvic floor. In the front or anterior is the abdominal muscles, primarily the rectus abdominis, transverse abdominis, as well as the obliques. And posteriorly are some back muscles, let's just say in general, that are also part of the core. So the core is just that. It's a full 360-degree experience, and they all work together when it comes to breathing. It's not just the diaphragm or the lungs or the rib cage. Intercostals are those muscles that are in between your rib cage. Now, they say that costal breathing takes up about or contributes to 25% of your tidal volume in terms of like how much oxygen you can breathe or how much breathing capacity that you have. And the diaphragm is responsible for 75%. So primarily it's the two of them, your rib cage expanding as well as your diaphragm contracting, that's responsible for your breath work in an optimal state. The accessory muscles are sometimes the muscles that tend to take over when the diaphragm is not working functionally. And these accessory muscles, they vary depending on who you ask, but they're primarily the SCM, the scalenes, pec minor, pec major. It could also be the serratus, anterior, posterior, inferior, and superior. So these are common areas that tend to result in pain or discomfort if your diaphragm is not working optimally as well. So we'll be able to look into that a little bit more deeply later. The abdominal muscles, which I mentioned earlier, like the transverse abdominis, the rectus abdominis, as well as the obliques, are also responsible in breathing when it comes to contraction or expiration when you exhale. And then the pelvic floor. Not too many people really talk about the pelvic floor and its role role in the breath itself, but it's also a very important component. If you see here in the image, it's sort of part of that balloon. And a lot of times when people have either an overactive pelvic floor or a weak or inactive pelvic floor, it could also compromise your breathing. And sometimes when I do an intake with my clients, if they tell me some sort of challenges they have around the pelvic floor, sometimes when we address their breathing, it corrects the pelvic floor issues. So we'll talk about that as well. Diaphragmatic breathing is something that you may also see in the yoga community where they ask you to sort of like distend your abdomen, where you can expand your belly. So we'll demystify that a little bit because extending your belly or expanding your belly does not always mean you're contracting your diaphragm. You can just simply be pushing out your abdomen. And so the abdomen filling out is supposed to be a natural process once the diaphragm contracts. So when the diaphragm, as you saw in the images before, is when the diaphragm contracts, the abdomen is supposed to just naturally expand. But some people who are sort of like really aggressive in terms of the way that their mind and body is connected, when I ask them to do some belly breathing, they might just push out their belly as opposed to inhale by contracting their diaphragm and allowing the belly to expand. So we're going to practice that as well because that is actually how you can train your diaphragm to work more optimally. So Louise, you had a question earlier about the respiratory muscles, about the intercostals and the diaphragm. They're both primary respiratory muscles and not accessory. So both the intercostals and diaphragm, they're actually supposed to work together and responsible together for 100% of your tidal volume. The percentages that I said earlier in terms of the intercostals being responsible for 25% and the diaphragm 75%, it's just a capacity. So let's say your diaphragm is locked or inefficient or inhibited, then it would force your intercostals to work more. It would actually force other accessory muscles and other areas of your body to work harder. For example, I'm going to go back to this image here. So if we go back to this image, let's say the diaphragm is inhibited and it's unable to contract. Now, when it contracts, it actually falls down. And as it falls down, the pelvic floor also drops and the abdomen comes out. So it's sort of like compressing that area, the abdomen comes out. Now, if the diaphragm has an incapacity to come down to create the abdomen to come out, what sometimes happens is the low back then compresses to sort of force the pressure. So that's why there's a lot of people with back pain when the diaphragm is inhibited or locked. So sometimes freeing up this diaphragm so that it can actually contract puts less pressure on the lower back. Now, in exhalation, or when you exhale, what happens is the diaphragm then relaxes or comes back up. The pelvic floor naturally it doesn't tighten, but it actually lifts. So the pelvic floor is supposed to lift. Now, for people who have weak pelvic floors, this may not actually lift. And what might happen if this doesn't lift, then it might cause other muscles, other accessory muscles to sort of make up for that process. For some people who have tight lower backs or even tight pelvic floors, during the inhalation process, there could also be an inefficiency in those muscles as well. So as you can see, like if you were to just imagine all of this working as a whole, and we're just looking at this from the lateral view, but even if we looked at it from the frontal or posterior view, and how you can see how it all works as a circle or a ball or a balloon rather, and that they all work together, and in one area will affect the other. So the diaphragm, in addition to it being a muscle of respiration, it's also a stabilizer of the body. Even before the diaphragm became a primary breathing muscle, let's say during childhood development up until like maybe 6 months, the diaphragm is primarily a stabilizer of the body because maybe the muscles of the spine had not yet fully developed, particularly the multifidi. Multifidi is responsible for stabilizing the spine. So if the diaphragm is inefficient, then there's a stabilizing that needs to happen, and it can actually cause the muscles of the lower back to work even harder. So I'm going to go to this new image here. So here's the diaphragm. It's sort of like a dome. It attaches anteriorly beneath the rib cage and posteriorly onto the lumbar spine. So you can see how when the muscle is either inhibited or even tight, it can affect tension in the lower back. So I think it goes all the way from like L1 to even like 3 and 4.
Is the psoas attached right there? Does the in the bottom of the diaphragm, does the psoas attach right there?
The psoas attaches anteriorly in the iliac crest. So if we were to look here, maybe around here, and also posteriorly to the lumbar spine, but a little bit more lower than diaphragm. But yes, they would affect one another indirectly. They don't necessarily work synergistically or antagonistically, but they would be affected only because they attach near around the other. So let's say you have a tight psoas, which is not allowing the lumbar spine to be as mobile as it needs to, then maybe this area is also going to be compromised because everything is inherently connected. So if we look at this image here, it kind of lists things out a little bit more in terms of the muscles of inspiration and expiration. So when you inhale, like we had just discussed, you're using the intercostals and the diaphragm. The intercostals are these muscles here in between the rib cage for each rib. The diaphragm, as we noticed here, is this beautiful, it's such a beautiful muscle. I saw it doing a cadaver dissection, and it's so beautiful. Like, it's enormous. It's so huge and thin, and it's really beautiful. And then the SCM is that thick muscle here that we addressed when we did the upper body release. Pec minor, which attaches beneath here. And as we all know, we all have pec minor issues, and a lot of times that's because of poor breathing. When you exhale, you're using the internal intercostals, also the muscles in between the rib cage, but now a little bit more anterior. The diaphragm as well. And the accessory muscles for exhaling are the abdominals and the QL. So again, if the diaphragm is inhibited or locked, when you're exhaling, what could be overworking are your QL. So that you can also have challenges with your QL if your diaphragm is not working efficiently. Does this all make sense?